So, good morning, everybody. Thank you very much for inviting me and giving me a wonderful introduction. Thank you. My name is Indra. You've heard a little bit about me, and I'm going to spend a very quick 15 minutes telling you about the NHS. So, let's have a little show of hands, because everybody always falls asleep by the time you get to my stage in the morning. In fact, let's stand up. So those of you in the room, can we all stand up, please? That's it. Shake those bums. Yeah, let's wiggle around a bit, because we're at a healthcare conference. We want to be healthy. We've got to do our 10,000 steps, you know. So those of you who have had an interaction with the UK National Health Service, the NHS, please stay standing. And those of you who have not, please sit down. Great. And those of you who have had the handful that are left, which is brilliant, great to see, can you tell me whether, if sit down, if your experience was bad, and stay standing if it was good? Well, it's good to see. Only 3 people sat down, and 1 person got back up again. So, thank you, sir. So it was sort of good, sort of bad, not quite sure. Okay, great. Thank you, everyone. You can all sit down, relax, and fall asleep now whilst I present the Digital Nhs. So the NHS serves a population of 65 million people, population of the UK. We have 1.2 million staff. We treat over 1 million people every 36 hours. That's a lot of people in a very short space of time. So are we digital? Can we do it? Are we there yet? Now, I've only got probably 10 minutes left now of my talk to tell you about a massive organisation. So I will probably pin down and tell you about a few things that the NHS is doing nationally to treat those 65 million people. We're divided into 10 programmes in the NHS, which are called domains. I work across letter A and B, so I do anything that is clinically facing with a patient, self-care, prevention, and also the digital urgent care space. In domain A, so in the A programme, what we're doing, some of you may have come across a website called Nhs Choices. It's a Wikipedia built by the NHS on any problem that you have. So be it from a rash that your 2-year-old might have to, I don't know, how do you get travel vaccines for your next holiday to Malaysia? So it's all there. All that information is there. But what we're doing is we're adapting that so it becomes a lot more personal. So it becomes something that's good for you, the patient. It has your own personal health record on it. It will have access to your personal health budget, which the UK is transforming. It will also give you information on the nearest services to you as a patient. And I'm not just talking about doctors, I'm talking about dentists, pharmacists, physios, whatever your condition might be, it has that information. So it will have something like a personal health record, but it's very adaptive to what the services are available in that part of the country. Now, this is a massive, massive project, and we've got a team of 200 people working on this in London and across the UK and Leeds as well. And if you think about it, it's very easy to transform a personal health record for a small population for 1 or 2 million people in a specific area. But when you're thinking about the nation, you're thinking about a whole country, to have to do this is quite a difficult task. But these guys are cracking on at it, and they are doing a great job. The next thing I want to tell you very briefly about, there's so many projects I could tell you about in the NHS, and I get very excited, and then I start speaking a bit too quickly. But I'm very conscious that I've got 9 minutes left, so I'm going to tell you about another one called online triage that we're doing in the NHS. So those of you who know, when you have an emergency, you call 999 or whatever it might be in your country. In the UK, we have a number called 111, and 111 isn't called in an emergency, it's called when something is urgent. Now, for those clinicians in the room and those people who are experienced in health, what is the difference between an emergency and something that is urgent? And when you, as a user or a patient, how do you know that your problem is not urgent? Because for you, If you're unwell, it's urgent. So this is a big problem we have. At the moment, we have 14 million calls going through annually of people calling 111, and we only have 6,000 call handlers. So we've got a big problem. We've got a lot of people coming in and not enough people going out. So what are we doing? In London, we've trialed something called the Patient Relationship Manager. So if I just talk you through this very briefly, let's see if there's a pointer on here. So you call 111, you have a problem. What happens? Your call gets routed through to the call handler. And at this section, if you are a vulnerable adult, somebody who is maybe on end of life, you live in a care home, you've got a care plan, this call handler will be able to identify that directly. And when you call or somebody calls on your behalf, they will verify that information on something called the Spine. The Spine is a national database with everybody who is registered with the National Health Service, the NHS, and you have your own unique identifier number. They will identify you, and then they will put you through down to the appropriate clinician, and that clinician will then have all of your details. So already up front, you are informed as a doctor or a nurse taking that call of all the background information on that person. So what, you say, great, we've done this a lot, but this is being rolled out nationally as well. So this has been piloted in London to a population of over 3 million. It's now being rolled out across the UK in different areas so that eventually it doesn't matter where you call from or who you call, we will have that information to hand on your background and your special care plans, so we'll be able to treat you much more effectively. And the idea is if you are a vulnerable adult and you do have an end-of-life care plan or a serious healthcare plan that people should know about, we won't waste your time going through endless questions, triaging you unnecessarily to an A&E. We will treat you either in your point of care or send you to the most appropriate place. So what they've done is they've also created a great little 256 sequence code that they can send to the ambulance service, who will then transmit you on to the right place of care. I'm very conscious that sometimes what I say isn't very techy, it's not cool, it's not exciting. But the NHS isn't really cool and techy and exciting. So I think we just have to draw that back. It's not, we're not doing crazy genomics and we're not predicting your end of life expectancy. What we're trying to do is treat a huge population equally, fairly, and free at the point of care, which is a task in itself. So going back, this patient relationship manager, we had to work across a huge number of providers. So these are providers, they're tech companies, they are ambulance care services, they're GPs, out-of-hour care providers, and they're also specialist care providers. So all of these people are involved in one way or another in trying to help transform care, to make things, and when I say digital, I'm not necessarily talking about talking on an iPhone or tracking your information. I'm talking about seamless transfer of data across systems. So this is 32 providers we've had to work across to transfer data seamlessly. So you, the end user, when you call, it's a one-stop journey. You call, somebody treats you, and you move on your next step of care. So digital NHS, are we there yet? Personally, I think we are. I think we've got a very, very long road. There's lots and lots happening. I've told you 2 rather large national projects that we're working on. But in pockets around the country, some people are doing some really exciting, crazy stuff. So I was speaking to a clinician yesterday, in fact, who has developed TMAX. I don't know if anybody have heard of it. For those of you who are in emergency care, you know that chest pain, biggest presenter, biggest cause of death. The presenter before me said hypertension, the silent killer. So your troponin, how do we predict whether or not you, as a patient who comes into the emergency department, should we keep you in or should we send you home? What likelihood of you dying if we send you home when you came in with chest pain? So he's developed an algorithm that learns over time using machine learning to use point-of-care testing troponins with an ECG and a clinician history to predict whether or not you should stay in hospital or you should be discharged. So that's just one example of a pocket of innovation happening in the NHS. Another one is a GP has used all of your health records, looked at them, taken out all the predictive values of you going to an emergency department to give you a score to say what is your likelihood in the next 6 months of ending up in A&E. And those people with the highest scores then get managed separately to prevent them going into A&E. And I could go on. I could go on and on telling you about what we're doing in the NHS to help it become a bit more digital. But I'm very conscious that I've now run out of time. And I don't want to carry on. But if you do have further questions, please do come and find me or my colleague Angela, hand waved up there. We're here for the next few days, and come and chat. We're always happy to chat. So thank you very much.